This is MSF Physiotherapy. Now, I was planning to use my anatomy book here and kind of go through stuff, but I think for lower back pain, it's so many things can play a part in or contribute to lower back pain that it's going to be difficult to get everything in one video. So let's talk about some of the things that can affect back pain to begin with. One is your posture. Posture abnormalities will lead to muscle imbalances, and vice versa. A muscle imbalance can lead to a postural imbalance. Now, postural or muscle imbalances over a period of a long time, if it isn't corrected, can lead to arthrogenic problems, joint problems. Say, for example, if I had a tight trap, and that tight trap stayed there for 6 months, I might find that every now and again I start to get tingling down into my hands, or I start to get some numbness. That's because in the brachial plexus, the nerves exit the cervical spine and they go through the brachial plexus and run down into the arm. Therefore, if my shoulder's tight, I'm compressing the brachial plexus. Nerves don't like compression, they don't like to be stretched. You all know if you hit your funny bone, it's not so funny. So now I've compressed. It's not through accident, it's through muscles being overactive and tight. It's pinched the nerve, now I'm getting nerve-like symptoms down into the arm. You can have a myogenic problem, which is like a muscle problem. For example, you've got a muscle down in the lower back called I'm going to say it properly, quadratus lumborum. You have two of them, one on either side, but when that muscle is tight, I've found in my experience that sometimes people can then have like sciatic-like symptoms. So it's not true sciatica, because true sciatica is caused by a bulge in the disc. That bulge in the disc impinges on the nerve root for the sciatic nerve, and so you get pain running down the leg or down into the toes, or associated weakness. Pseudo sciatica is not caused by a bulge in the disc, but it's caused by the muscles nearby which are tight and impinge on the nerve. Same thing can happen with piriformis syndrome. It's a muscle that's got a little bit deranged, it's overworking, and because the sciatic nerve, well, in some people, the sciatic nerve goes through piriformis, and in other people it goes next to. So, whether it goes through or next to, if piriformis is deranged and is tight, then it's going to press on the sciatic nerve, and if you've had sciatica, pain running down the leg, then you know it's not nice. But that's the difference between an arthrogenic and a myogenic problem, and also a neurogenic, which is a nerve being pinched, which again gives you the neural symptoms down into the leg, fire, tingling, really sharp pain. Now, I've already spoken that posture can have a big effect on pain. Also, the activities that you do. If you do activities that are monotonous, hardworking, if you're a cleaner and you're always down, or you're always wiping up overhead, you can in a way encourage some wear and tear or lower back pain symptoms if you've already got a tight back, or your musculoskeletal system, you're a little bit tight anyway, a little bit stiff, or you've already had back pain before, or if your parents have had back pain, because let's look at it this way: we're all individual, and you get 50% of your DNA from your mum, 50% of your DNA from your dad. If both your mum and your dad have a bad back, then there is a good chance that if you don't kind of work on maintaining good mobility, that you could yourself get a bad back. Because let's look at it: your mum's got a bad back, that's 50%. Your dad's got a bad back, that's 50%. So, but then lifestyle can improve that. So if you've got a better lifestyle than your parents, you exercise, you stretch every now and again, and you do what you need to do, yeah, within moderation, then hopefully we can reduce those chances. What else? I'm going to pause it there. I'm just trying to think what else. The important thing for lower back pain is that unfortunately it needs to be assessed. There isn't a one plaster fits all, because everyone is as individual as a fingerprint. Although we all have two knees, or most of us have two knees, two elbows, eyes, ears, bones are made up of the same consistency, we all use them differently. And so if you overuse a muscle, that it will become stronger. The muscle will exert its force on the bone that it attaches to, and so on. It's not just that bone, because then if you've pulled one bone, look, if I move my shoulder, you can see that it's not just my shoulder that moves. Yeah, if I move my head to the side, it's not just one vertebra that's moving. One affects the other, and so it's I think I can just see a cat that's going to bully my cat. I'm going to go and stop this. Better get away from my cat. Apologies. That cat's been bullying my little cat for a little while, man. He's lucky. Anyway, so definitely and that's why an assessment is needed, because everyone has their own individual reasons as to why they're getting back pain. The back pain might be in the same area, location. It might feel similar to what someone else has described, but pain is an individual experience. You can only explain to someone how it feels for you. No one's truly going to know, not even twins. Everyone has got their own perception. Like my 5 out of 10 pain might be someone else's 3 out of 10 pain. Someone else's 2 out of 10 pain might be someone else's 7 out of 10 pain. So it's all different. Someone might feel it as a dull pain. Someone else might say it's a sharp pain. So it's all individual, and as individual as everyone's experiences, as individual as everyone's fingerprint, your treatment has to be individual, because one person might have pain because their back is really stiff at the joint, L4, L5. Therefore, it has to be mobilized. Someone else might be that their quadratus lumborum is tight on that side, or their hip flexors are tight on that side, and that's why you're getting some referred pain into that area. Or it could be that they've hurt their shoulder, and because they've hurt their shoulder, they've adapted their posture, and because they've adapted their posture, that is now bringing on a bit more pain. There's so many different reasons as to why you can have back pain, knee pain, elbow pain. That's kind of why you kind of have to get it assessed. Doesn't mean that you have to book yourself in for 150 sessions. It just means that, right, you get an idea for what your pain is, why it's being caused, and a plan for how you're going to fix it. I'll come back.